Well, hello, everyone, and welcome to Dementia Unplugged. I'm Jeannine Forrest, and I am very honored to have you join me today as we talk about planning for holiday parties and vacations. I'm going to start with a word first from the president of the Dementia Society of America, Kevin Jameson.
Welcome. Please listen to this important message from the Dementia Society of America. All content, including any potential medical information, is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment process. It should not be used as a substitute for professional diagnosis, care, and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. The opinions expressed and the content shared by Dr. Forrest are not necessarily the opinions and content of the Dementia Society of America. Thank you.
As we get started, I just want to go over what we mean by the word dementia. The word dementia is sort of an umbrella term, and under it are many different types of conditions that can cause symptoms that create cognitive impairment. There are many different types of subtypes of dementia, and the most common are Alzheimer's disease, vascular dementia, sort of a Lewy body or frontal temporal dementia. Regardless of the type of dementia that you may be experiencing or caring for a loved one or patient or client, the general concepts will apply when we talk about planning for the holidays and parties. I want to start out by a quote by Virginia Satir, who's a family therapist that I think captures sort of the essence here. Life is not what it's supposed to be, it's what it is. The way you cope with it is what makes the difference. That's kind of a motto that I feel is helpful when we're thinking about the holidays. Quite often, myself included, we have this, sort of an unrealistic vision of what the holiday should be like, and the expectations and the Hallmark vision. But when we're caring and loving someone with a dementia, that may not fit that paradigm. And so the way we cope with it, the way we respond to the changes of someone who's experiencing cognitive impairment will make all the difference in helping to make the holidays pleasurable and joyful. So I have a picture of the Norman Rockwell sort of perfect holiday experience. This happens to be the Thanksgiving famous painting. And so if that's your vision, that's lovely. But I want to spend some time about helping you sort of reframe what the holidays could be like, and so that you're both experiencing sort of more joy out of the experience. I'm going to encourage you to think about the 4 Ps. And the 4 Ps include planning, perspective, patience, and prevention. And in order to make the holidays, and when we'll talk a little bit about vacations, more joyous, it does take a little more planning ahead of time. You want to take on the perspective, a larger perspective of what's really important, and also the perspective of the person who is experiencing changes within their cognitive functioning. So trying to see the world through their eyes, through their perspective, will be important as you plan and sort of make extra activities and try to have them more meaningful during this time. But I'm going to encourage you to take on their perspective. Patience. My goodness, this is helpful for anyone during the holidays, but patience will play an enormous role and either making it, sort of a happy time or a more stressful time. And then I'm going to spend a little time on what I call prevention. You'll hear me say a couple times what you do want to prevent during the holidays and during vacations is over fatigue and overstimulation, and I'll explain why. The brain is changing regardless of the type of dementia. The brain is changing on a structural and cellular level. I happen to have an MRI here shown of someone with frontal temporal dementia. And on the left, you can see a brain that is fully encased within the cranium. It's dense. On the right, you can see tissue that is more uneven. There's more spaces. It shrinks. I do this because these changes are hidden when we're looking at a resident or loved one. These changes are hidden. And so we may be seeing changes in thinking and behavior that may be difficult to explain, but what's happening is that the cells and the neurons and the connections are not what they used to be. And so this is what's driving the behavior. And so in order to make holidays more joyous and stress-free, it is important to stop and think about how important it is to support what remains, what abilities still continue. So what I'd like to say is that people with dementia and cognitive impairment, what I've seen in my clinical practice and in my own family members with various types of dementias, is that there can be less ability over time, but there's less need to have more exciting activities, sort of nonstop hoopla and a flurry of activities. People are much more content to maybe do just one thing during the day to make it meaningful and pleasurable. Routine and structure are important to navigate the day. Imagine having to really think about everything that's coming towards you in terms of visual or auditory stimuli and trying to make sense of that. The brain gets easily fatigued. And so if there's overstimulation with loud noise and crowds and parties and music and merrymaking, that fatigues the brain, which can lead to more anxiety and distress, which is something we're all trying to prevent. Our own brains, those without cognitive impairment, we can get overly stimulated and fatigued and that can cause anxiety and distress. So these are good guidelines for all involved. Underneath all of this message is for us to remember what the holidays and vacations are really about, the larger perspective. It's the need for social connection and the need for love. That remains, whether someone is within the beginning stages of a dementia or the late and final stage. That need, that part of the brain never goes away. And so use this phrase, move from the extravagant to the essential. We don't need all the bells and whistles to make it meaningful. It's that time spent together, that connection with others, with family members and friends, with grandchildren, with favored pets that really underscore why we're celebrating the holidays and vacations in the first place. So you can see I'm stressing this point, but we want to prevent overfatigue and overstimulation. And it's possible. And so I'm going to share with you some helpful hints to make it happen. The first is if you're the care provider, caregiver, care companion, care partner, you want to fuel your own patients by taking care of yourself first. The last thing someone with a dementia needs is a stressed out caregiver, because you become more irritable, I become more irritable. It's not pleasant for anyone. And so you need an extra dose of patience. And so do whatever that takes. Take maybe a longer shower, bath, meditate, breathe, light some candles, go for a walk outside in nature, pray. Do what it takes to take care of yourself first so that you have the energy and abundance of patience and love to care for your loved one. So what to avoid? Clutter. And that can easily happen, especially if there's extra decorations and I'm just thinking electrical cords and packages and all of those things that can create a visual overstimulation. So less is better. Avoid large parties, crowds, whenever possible. Get a sense of what you are going to be in what kind of party will take place. So being in Times Square during New Year's Eve is probably not good for someone with some degree of dementia, cognitive impairment. This certainly can cause overstimulation. And the other one is overscheduling. We have a tendency to want the holidays to be perfect. And so we try to cram it all in. But in reality, this is counterproductive to enjoying the holidays. So what does help? What are those holiday helpers? Think about what abilities remain. What motor skills remain. The ability to be present, the ability to help and assist, perhaps with food preparation. Someone with executive functioning changes may not be able to start a recipe from the beginning to end without assistance, but certainly, for example, can roll cookie dough or make, cut out cookie decorations, set the table, create holiday cards and ornaments, participate in some games, certainly singing along. And so we want to support holiday traditions. Those are important to everyone involved, whatever they may be that's been important to your family. But I would say approximate them. They may not be the full-blown, 6-hour party that you've come accustomed to. So we need to sort of reframe so that it is dementia-friendly and dementia-appropriate. Other holiday helpers. If you are going to visit someone else, some other party, I'm going to encourage you to help the person with the dementia to rest before. This can take form of just having quiet time, perhaps a nap. I find this in my clinical practice and with my own family members with cognitive impairment. That it is helpful just to kind of chill. It relaxes the brain and just sort of prepares for a more unusual event. Be flexible with time expectations. You may not be able to see the party from beginning and be the last one to leave. Expect maybe an hour max. Look for signs of anxiety and distress. People with dementia can certainly participate, but we just need to be mindful of, like I said, of over-fatiguing by being there too long. It's important to locate the restrooms right off the bat, particularly if people are experiencing incontinence. We don't want anyone embarrassed, and so be mindful of locate the restrooms. It may also be helpful to find a quieter room within the home. So if everyone is congregating in the kitchen, like many parties, find a room perhaps to the side where if you're seeing someone become a little overstimulated, that they can have some quiet time, do some deep breathing together, and then return to the party. Another one is to keep hydrated. Now, I don't mean with alcohol. I mean, with here I have, I think this is a club soda with lime. Even during the holidays, it may be warmer. We might be wearing warmer clothes, and people with cognitive impairment, particularly dementia, where they may forget if they're hungry or thirsty, still poses risk for dehydration. So frequent reminders to stay hydrated. Play familiar holiday music. If we're moving towards Hanukkah or Christmas, which is something that as we're talking now, we're moving into that period, and so that's why you're seeing these particular holidays on the screen and being emphasized. But this could be appropriate for any holiday during the season. But music stimulates long embedded memories, and I've seen people in the very, very late stages of dementia being able to sing along to second and third verses because those older memories are embedded. And so music is a universal language that connects to our soul and can really, really express emotions and joy. And this can be intergenerational. As we move from the early to especially more later and advanced stages of dementia, focus more on the senses. And so this is certainly smell and taste and vision and touch. So aromas, wow, waking up or smelling hot chocolate, pine needles, baking bread, cookies. Doesn't that just sort of bring back all sorts of wonderful memories of childhood and growing up? The same is important, and even more important when words become less available. It's the senses that make the experience more meaningful. Warm blankets, cuddling with pets. I've had either go out and make snowball snowmen or bring it inside and enjoy, that sense inside. Looking at photo albums together. Now, people over time may not remember exactly who the family members are, the exact names, but it's that connection. It's the sense that, yes, these are friendly people who I feel love and have loved. Read together, hold hands. When you're thinking about gifts for someone with dementia, I give you these ideas. A gift would be to capture and record their stories. There are now a whole host of different organizations. You can look on the web, and there are recording albums that people can tell their story and embed pictures so that those memories can be shared for generations to come and in their own voice. Clothing. Now, this is something to really pay attention to. I'll give you a story. I worked with a family whose mother was quite the fashionista, and so they had a tendency to buy her all sorts of fancy outfits. But the mom only really gravitated to one or two outfits, and they were disappointed, thinking she didn't like them, or their care providers didn't care to change, and rotate the outfits. But really what was happening, she had a difficult time buttoning, snapping, zippering. And so the mom gravitated to clothing in which she could actually put on herself. So think about that. Maybe shoes with Velcro or don't have laces, or just pull on, or with some kind of elastic waist. So think about that when you're looking at clothing. Other gifts would encourage creativity. Creative projects and materials. What I love about that, there's no right or wrong. And so watercolors, molding clay, arranging flowers, sanding wood, sorting, those kinds of things work well. Some people enjoy what we call therapy dolls, or lifelike infants or dolls in the later stages of dementia. This is not to infanticide the person who's older with dementia, but to draw out their nurturing essence and create a connection. I've also had people connect to robotic dogs and cats when they can no longer have one realistically in their home. Quite often, the dogs and cats are quite realistic, and there's a wonderful bonding. And like anything else for the holidays, your time and your presence are an enormous gift. Just spending time with loved ones is a wonderful way to recognize the holidays. Now, I'd like to say a few words about vacations or trips, particularly around holidays. In the past, or it may be you were accustomed to visit people out of town or go somewhere. That is still possible. In general, early and middle stages of dementia, that's certainly possible. In the late and final stages, in general, most experts agree that that may be too cumbersome, too difficult for all involved, but I'm going to give you some ideas of how you can still travel, in quotes. So don't forget the 4 Ps. The planning, perspective, patience, and prevention still apply. Keep remaining abilities in mind. And there's a whole variety of modes of transportation, from driving to using the train, flying, cruise ships. As a matter of fact, there are more cruises being designated, particularly for people in early to middle stages of dementia. So that may be something to consider that hasn't been years before. So what I would encourage is to do a, quote, test trip. See how people do, knowing that routine and schedule is really important for people with dementia, not to over fatigue the brain. So maybe go to a local hotel or local restaurants and try that out first. See how people adapt. If you do plan on traveling, try to keep the travel time to 4 hours or less. That's good for anyone. But again, we have to remember what's happening behind the scenes, that the brain cells and structure are changing, and people are less resilient to stress. I find driving more flexible and predictable if you need to stop. You really can't, ask the pilot to stop in the middle of a long flight. So driving may be more predictable. I would encourage you, especially if you're going to be in unfamiliar territory, is to get an ID bracelet. As a matter of fact, Dementia Society of America is just starting what we call Keep Safe ID. It's sort of an electronic mechanism that is sort of GPS embedded. And so in the unfortunate event someone would be lost and you couldn't find them, this is a way of identifying location. When you're on vacation, consider rest periods and always plan for similar bedtimes. What to pack? Of course, change of clothes, but something more immediate in case there is a problem with incontinence. I'll list others. There are medications and food allergies, medical history, health insurance cards, certainly medications, adequate amounts. Extra food and water, extra batteries for hearing aids, and incontinence supplies. Those are kind of the essentials to not leave home without. In terms of air travel, if that is going to be your mode of transportation, I would encourage you to buy travel insurance in advance, just because life can be a little more unpredictable. Notify the airline in advance that you are bringing someone with cognitive impairment. Just getting through TSA can be stressful and confusing for anyone, but even more so if memory becomes more impaired, planning becomes more impaired, just removing shoes, following directions. If you're going to have tight connections, particularly it may be more useful to get a wheelchair to move people throughout the airport. A couple other thoughts. When it becomes a time where traveling outside to another state or hours away becomes just no longer the alternative. Vacations are still possible. And so I call them the staycations. They're world travel alternatives. So you bring the world to your living room. So I've had family members have a whole French Paris experience, playing French music and having wonderful French cuisine, looking at this croissant, and having slideshows of Paris and France flashed up on a screen, or picture books. And so you can travel to Paris and come back and be in your bed all toasty and warm by the end of the day. Another option is perhaps a Caribbean or Hawaiian island adventure. People can wear their Hawaiian garb, Hawaiian shirts, leis, put on some Hawaiian music and dance together, tropical drinks, recreate a luau in your living room. I've brought in sand and we've built sand castles together. So you are bringing that world right into the home. And so this certainly is a wonderful way of just creating a meaningful, quote, vacation, time away, and enjoying the experience. So lastly, I want to leave you with this thought. People often ask, well, should we even bother if someone's memory is severely impaired? Sort of what's the point? They won't remember anyway. And I say definitely it's all worth the effort and the meaning and the extra time involved. Because if this moment will mean nothing to me later, this is from the point of view with someone with dementia, it still means everything to me right now. If this moment will mean nothing to me later, it still means everything to me right now. And this is just a wonderful way of thinking about holidays and vacations, that it's all about the present moment. I find that caring for, working with people with dementia, the gifts that I receive and learn is to be more present in the moment, because that's really all that we have. People with dementia are less concerned about the past and mistakes about the past and worrying about the to-do list in the future. But people with dementia are just wonderful role models of teaching us how to appreciate the present moment. So these are ways that we are learning to care before finding the cure. I put cures for any of these dementias. We unfortunately don't have a cure or cures right now, but we can certainly learn how to care. If any of you would like a one-to-one consultation, more information specifically to your situation, you can certainly contact me. My website is called Through the Forest, and Forest has 2 R's, just like my last name. So that's www.throughtheforest.com, or call at 773-704-1834. And I would be happy to spend time talking to you. I also want to thank the Dementia Society of America for hosting Dementia Unplugged. And it is a wonderful resource, volunteer-driven, and I would encourage you to donate if you can to keep this and sustain this wonderful, wonderful organization. And so I am next going to stop the recording so that I will open it up to questions. Find the chat button, send me a question, and that way it will keep your privacy. So I did want to say one more thing, that all of these programs are now available and will be are recorded, so you can go to Dementia Society of America website to listen again or share with your friends, and they're also available on YouTube.